Today we're tackling a huge question at the intersection of AI and healthcare. When it comes to technology in the exam room, what do patients actually want? We're going to get to the bottom of this by doing a critical deep dive on a fascinating new research paper. Let's get into it. I mean, think about it. We've all been there, right? You're in the doctor's office, you have a question, maybe it feels a little personal, or you think it sounds silly. The doctor looks busy and you just don't ask. It's a really common experience.
So that brings us to a really interesting idea. What if you could just ask a robot instead? This is the core question behind the study we're looking at today. It's by Natalia Delavalli and her colleagues, and it's called What Patients Want from Healthcare Chatbots. Now, we're not just going to summarize their findings. We're going to do what real scholars do. We're going to dissect their methods and really evaluate their work.
Okay, so here's our game plan. First, we'll set the scene. Then, we'll look at the research blueprint, how they actually did the study. After that, we'll get to the juicy stuff, what patients said. We'll put it all together with a critical perspective, and we'll wrap up with a toolkit you can use for your own work.
So, first up, AI in the doctor's office. It's important to understand that the research we're talking about isn't some theoretical thing. They were studying a real multitask chatbot that's already being used in a major U.S. healthcare system. So understanding what patients are experiencing is absolutely essential if we're going to roll out this tech responsibly.
All right, on to our second section, the research blueprint. For any of you studying science or tech, this part is everything. The conclusions of a study are only as good as the methods used to get them. So, how did they find their answers?
The researchers used what's called a mixed methods approach. And I love this analogy here. It's like using two different camera lenses. You've got the wide-angle lens to see the big picture, and then you've got a magnifying glass to zoom in on the tiny, important details.
And here's what that looked like in practice. The wide-angle shot was a survey of over 600 chatbot users. That gave them the broad, quantitative data. But then, for the magnifying glass, they did these deep dive interviews with 46 patients and a couple of developers. That's where they got the rich personal stories, the why behind all the numbers.
They also used another really important technique called purposive oversampling. That's a bit of a mouthful, but all it means is they intentionally went out and recruited more people from underrepresented groups. Why? To make sure their voices weren't lost in the data. It's like making sure everyone at a party gets a chance to speak, not just the loudest people.
Now, this is a huge part of critical thinking. No study is perfect. A good paper will always admit its own limitations. For this one, the findings are all from a single healthcare system, so we have to be careful about generalizing. The survey response rate was also kind of low, just 20%, which could mean the people who responded are different from those who didn't. And get this, nearly 1 in 3 users didn't even realize they were talking to a computer. That could definitely change how you answer questions, right?
Okay, so we've looked under the hood at how they did the research. Now for the main event. What did patients actually say? Let's dive into the core findings.
This diagram from the paper is fantastic because it tells the whole story. On the left, you see the kinds of tasks patients use the chatbot for. Some are just administrative, like scheduling, while others are more sensitive, like asking about mental health. And on the right, you see why. For administrative stuff, it's about convenience, saving time. But for the sensitive topics, it's all about avoiding judgment and getting more privacy.
And the numbers really back this up. Look at this. When asked about worrying about being judged, over 36% of patients felt that way with a human doctor. But with a chatbot, that number drops to about 25%. That's a really significant difference, and it tells us that people genuinely feel safer, or at least less judged, talking to a machine. And here's the human voice behind that statistic. One patient put it so perfectly. It's a robot, so they can't judge me. That single quote just cuts right to the heart of the matter. It explains so much about why a chatbot can feel like a safe space. But, and this is a huge but, that comfort with AI has a very clear limit. When it comes to something as high stakes as getting a diagnosis, the preference flips completely. Patients still want a human.
And this quote just nails it. A patient, referring to the chatbot, said, "What would she be able to do? Because she can't diagnose because she's not human." This really gets at that deep-seated need we have for human expertise, empathy, and judgment when the stakes are high.
So, let's move on to Section 4 and try to put all these pieces together. What does this all mean when we step back and take a critical look at the bigger picture?
This is where things get really complicated and interesting. There's a real ethical tension at play. On one hand, it's great that chatbots can be a safe space.
But on the other, what happens if doctors stop getting practice having these tough, sensitive conversations? And while most users think the AI is unbiased, we know from tons of other research that AI can inherit and even amplify human biases. And then there's the privacy paradox. People want privacy, but they have no idea who is actually seeing their chat history.
Okay, this brings us to our final section, and this one's all about you. I want to give you a practical toolkit that you can use anytime you're reading academic research. These are the key lessons to take away. Here it is, your 3-step toolkit for reading research like a pro. Step 1, always evaluate the methodology. Ask yourself, who did they study, and is the evidence solid? Step 2, hunt down the limitations. What did the authors admit were weaknesses? Can you really apply these results to everybody? And step 3, balance the potential with the pitfalls. What are the cool benefits, but also, what are the hidden ethical costs? If you do these 3 things, you'll be well on your way. So to wrap up, AI is going to redefine medicine. That's a given. And as the study shows, it has some incredible potential to help patients feel more comfortable. But as we move into this future, the really big question we have to keep asking ourselves is this: how do we build these systems not just to be smart, but to be trustworthy? How do we make sure that technology strengthens and doesn't break the trust at the very heart of medicine?